All right, kind of a wild week. I'll end with the salacious news because I know everybody already knows that it's coming. So let's start with the boring stuff because I'm also always here for the boring things. It is important to know that Michigan has just issued their first license for a dental therapist. For those of you who aren't familiar with what a dental therapist is, it's a mid level provider somewhere between a dental assistant and a dentist. What the specific regulations are in Michigan, I'm not 100% sure. Doing reversible procedures, preventative services, diagnostic services is typical for a dental therapist. Up until recently, they've all had to be trained out of state, which is probably also why there are not that many, only one so far. But they are opening up a program at Ferris State University. So they are going to start training their own in house dental therapists to be licensed in the state of Michigan. This is the ongoing, continual discussion. We're seeing all kinds of solutions coming out of different states to try to deal with workforce challenges, finding dental assistants, dentists, and dental hygienists to be able to perform services. Some are doing these really expanded. I think Arizona just released this very expanded dental assistant who's moving into some of the hygiene roles. You're seeing mid level providers, you're seeing expanded on the dental hygiene side too. So, anyway, lots of activity continuing to happen to sort of address the compression in staffing shortages. So, this is Michigan's now online with their first dental therapist. I love this next story, and I'm not going to be bashful about it. And I'm even going to mention the name. A class action lawsuit was filed at the end of the year, December 31st to be specific, by Kevin Walsh of the U.S. District Court for the Southern District of New York. Who did he file it against? Delta Dental. What is he upset about? Something I'm also very upset about. It's the lack of disclosure for out of network providers. So if you happen to be not in network with Delta Dental, but patients would like to continue to see you in your practice, you are unable to get a fee schedule from Delta Dental. This isn't unique to Delta Dental, and I won't pick on them specifically. This is actually an across the board problem with most of the dental insurance companies. If you're not in network, they will not disclose a fee schedule, but they will disclose a coverage rate. So let's do an example. I'm going in to get a dental exam. My dental insurance tells me it pays 100%. The person that I'm going to see who's not network doesn't know the 100% fee schedule. So is it 100% of the doctor that I'm seeing's fee schedule, his normal or her normal schedule? Or is it another schedule that none of us are aware of? Why does this matter? Because despite popular opinion, dentists actually don't like to surprise bill their patients. They really like to be incredibly upfront. In fact, I will go as far to say we take that incredibly seriously, more than the medical profession. How do I know this? Because I've had enough medical procedures done to know no one ever sat me down, showed me a treatment plan, explained to me how much my out of pocket was going to be. I just started getting bills in the mail. So dentists don't do that. They're a cottage industry. They work in their communities. They want to be able to look you in the eye when they see you at the grocery store. So they want to be able to disclose. They don't want to send a surprise bill. If they can't get access to the information, we cannot wholeheartedly give you a treatment plan where we really understand what your coverage is going to be. So I'm all in, Kevin Walsh. If you need support or help, call me, because I am glad that someone is finally taking a stand to say, doctors are genuinely trying to do right by their patients. These malicious and discretionary tactics by all dental insurance companies to make that more difficult is only at the detriment of the doctor and the patient relationship. So if you care about services, if you care about patients, and you care about coverage, which is in most of the mottos and missions for all dental insurance companies, be open and transparent with your in network and your out of network doctors who are just trying to take care of the people who call you their insurance company. Another really interesting article that came out that was a little contentious, a little clickbaity, if you want to know my opinion, was this new ADA article that came out about updated guidelines on radiation exposure. And in fact, a lot of the clickbait was for the title that said updated on an as need basis. Now, that's really the medical model. I don't, except for a few cancer screens like your colonoscopy, your mammograms, and those types of things that somehow got through this magical lobbying ability. For the most part, medical providers do not take images of you, CBCTs, MRIs, etc., unless you have a chief complaint. Dentistry is a little different. We like to operate more on a preventative side based on risk factors to capture images on patients. Well, the ADA's clickbait headline, I don't think it's all ADA's fault, it was how it was reported, is that now they're updating it to an as need basis, which would really start to move towards a medical model. Why do I care? Because really that starts to open up the idea that medical or dental insurance companies might stop covering radiography on the intervals that they're currently covering it. Now, we abide by the Alera principle, which is to use radiation as low as possible to achieve the results and take it as infrequently as is necessary based on risk factors for the patient. And there are a lot of guidelines that were just sort of massaging the 2012 guidelines that came out over almost 2 decades ago now. No, 1 decade ago. Woo. That give us all of those recommendations. There's a few updates and a few nuances that you probably should log on and check out to make sure that you're currently practicing within the guidelines of the ADA. But other than that, there wasn't this big aha moment within these guidelines to say, oh, we should be doing things differently. Doesn't really matter though, because if it hits mainstream press or if the insurance companies decide to use this as an action item for their reduction of benefits, ultimately we're going to start to see that change. I love that Chad, I talked to Chad about this not that long ago. You know, a lot of insurance companies require imaging that I don't even need to take in order to do a procedure. I don't need an updated panoramic image on a patient that I want to do a partial on. That is not required for me to make a partial on a patient. If I have an image within a certain time period of a pano for pre-screen for pathology, I don't need a pan to make a determination on whether or not a partial is indicated. But the insurance company wants that image. So now, do I take an image just to help the patient get reimbursed, or do I cite this most updated article that states that I should only be taking images that would be absolutely necessary in order to do my job, not to ensure insurance claim coverage? And the last story of the night has made national news. The two dentists that were murdered in Ohio, now the ex-husband has been arrested for charges of double murder. He's a vascular surgeon, seemingly kind of normal guy. No major things have ticked off about this guy yet. We don't know. And of course, he is innocent until proven guilty, but quite interesting turn of events in this story that the ex-husband of the wife who was murdered, along with her husband, has now been taken into prison for suspected murder charges. And with that, that's the news.